short report has some good points, so I'm including it again here in the section on adaptation for the health sector. This is a joint WHO and UNDP report for Europe and Central Asia region addressing climate change and health, a joint value proposition and service offering. Schematically speaking, health impacts of climate change, we have looked at this before in this course as well as in the course on climate and health in some detail. So we are looking at various factors like rising temperatures lead to increased heat strokes and deaths related to cardiovascular or respiratory issues. Extreme precipitation and flooding result in injuries and damages of health infrastructure and aggravation of waterborne diseases. Mud flows and landslides cause accidents and injuries, and changes in temperature and precipitation lead to a redistribution of vector-borne disease agents. Okay, so more specifically, if you look at some numbers, between 2030 and 2050, climate change is expected to cause 250,000 additional deaths per year due to malaria, malnutrition, diarrhea, and heat stress. This, of course, is an estimation, a projection, which makes several assumptions about whether there will be a vaccine for malaria, whether the world will do a better job of taking care of malnutrition, and water quality issues and heat stress can be dealt with technological solutions and so on. So you have to take it with a pinch of salt. Nonetheless, whether you live in a rural village, small island or coastal town or a big city, climate change will threaten your health. So droughts, floods, and heat waves will increase as of the projections, but as I've said before, this has to be made region specific. Such broad categorization is not applicable at every local level, but adaptation, especially for health, are very local, so that we have to remember. Vector-borne diseases like malaria and dengue virus will increase with more humidity and heat. This is generically true, but it turns out there are some subtle details such that very heavy rain events tend to wash out the mosquito population, whereas lighter rains tend to favor their growth in abundance. Basic necessities will be disrupted, so food, hunger and famine will increase as food production is destabilized by drought. So again, region specific issue. Air pollution and pollen seasons will increase, leading to more allergies and asthma. In general, pollution has increased everywhere. It isn't clear whether we are heading towards cleaner air anytime soon. As for water, warmer waters and flooding will increase exposures to diseases in drinking and recreational waters. So there are strange combinations. Droughts can also create waterborne diseases because people congregate to remaining little water that's full of diseases, snails, schistosomiasis. So there are some interesting dynamics that happen even when there is a drought. And of course, flood is the other way with lots of pathogens and spreading by waters. Both organizations prioritize approaches that support, so WHO and UNDP, a nexus approach, developing integrated and multi-sectoral climate change strategies featuring strong health components. So this is about integration. We talked about development nexus with other things. So we have, adaptation and development have to be synergistic, and we have food development and poverty nexus, FDP, and so on. Systemic resilience, advancing climate resilient health systems, both organizations want. Comprehensive adaptation, so promoting comprehensive adaptation initiatives. Food security that we talked about in the previous section in some detail, fostering resilience for food security. Safe water, supporting safe and climate resilient water, sanitation and hygiene services, and coastal management. All these map onto the sustainable development goals as well. Informed decision making, creating improved climate information and early warning systems, which we have talked about in pretty much every context. Climate resilient energy, building climate resilient energy and infrastructure platforms, which is very critical for health resilience as well. Let's read off a few points towards strengthening national health adaptation and mitigation capacities. Let's look at this schematic here. 10 components comprising the WHO operational framework for building climate resilient health, which we already looked at before in terms of climate resilience on this end. So we are looking at climate and health resilience, leadership and governance. So financing is important here. Leadership and governance is important in the inner circle of building blocks of the health systems. On climate resilience, in the outer circle, you have health workforce, vulnerability. I have a hard time reading this. Vulnerability, capacity, and adaptation assessment. Sorry about this. I should probably separate that and put it as a separate big figure. Let me do that and pause this here. This is on the fly adjustment adaptation. Okay. Okay, sorry about that mess. So here we are recording again on the schematic of 10 components comprising the WHO operational framework for building climate resilient health systems. We looked at a similar schematic in the previous podcast. So here that was also a WHO guideline report for Health National Adaptation Plan. In the outer circle we have climate resilience, which includes leadership and governance, health workforce, vulnerability, capacity, and adaptation assessment, health and climate research, integrated risk monitoring and early warning, health resilient and sustainable, climate resilient and sustainable technologies and infrastructure, management of environmental determinants of health, climate informed health programs, and here we have emergency ready preparedness and management, finally climate and health financing. In the inner circle we have building blocks of the health system. So again you need leadership and governance, health workforce, health information systems, essential medical products and technologies, service delivery, and financing are always very critical. Looking at again towards strengthening national health adaptation and mitigation capacities, our joint WHO-UNDP offer is to assist countries in the European and Central Asian region in holistically addressing gaps and barriers identified in the domain of climate change and health in order to strengthen national health adaptation and mitigation capacities. The service offer may focus on, but is not limited to, the following aspects and activities. So you can think of these as examples of services. Enhance climate and health evidence and risk knowledge. So again, remembering risk is a multiplication of hazard, vulnerability, exposure, and response. These need to be quantified and maps be ready. So this can be done by conducting vulnerability assessments, including economic analysis of damages, analyzing health co-benefits of reducing carbon emissions, so that's the mitigation part, enhancing enhancing early warning systems, building health stakeholder capacity to work with weather and climate information warnings, enhancing interagency communication and coordination on information management, monitoring climate health impacts and incidence of climate-induced non-communicable and communicable diseases to feed into national and international public health policies, and finally supporting the European and Central Asian countries in participating in the joint UNFCCC and WHO countries climate and health profiles project. These ideas are applicable to all the regions, so I'm reading them off even though this was specifically written for Europe and Central Asia. Ensure that climate change and health considerations are mainstreamed into relevant climate and health related policies, legislation, regulations, strategies, and plans through promoting a nexus approach to harness intersectoral synergies. Nexus is basically to try how to connect and track how changes or adaptation in one sector affects other sectors and then feeds back. So water, food, energy, health, transportation are all nexused, for example. Facilitating formulation of national health adaptation plans, promoting appropriate national resource allocations, facilitating access to climate finance, and building capacity to implement integrated climate and health related policies and plans. I think I'll read all of them just so that each point is important, that we can kind of get a sense of the bigger picture of climate resilient health system. Building institutional capacity and enhance coordination with other sectors through capacity assessments to analyze vulnerability and adaptive capacities, facilitation of interagency and cross-sectoral coordination, capacity building for an integrated nexus approach to cross-sectoral resilience, enhanced financing strategies, and building human resource capacity, including targeted training for decision makers and health sector practitioners. Next step, improve preparedness and enhance climate action in the health sector. So let me skip reading these then. Increase climate and health literacy and promote inclusive healthy lifestyles. Enhance regional action and cooperation as well as knowledge sharing. And in pursuing the above mentioned activities, best practices in health adaptation and mitigation will need to be considered, which include applying a health in all policies approach by which health implications of decisions in all public policies are accounted for, synergies are promoted, and negative health outcomes are avoided in a transparent and accountable process. Considering the commitments to safeguard health in the rule book for the Paris Agreement, and systematically include health in nationally determined contributions, national adaptation plans, and national communications to UNFCCC, as well as Health National Adaptation Plan. Integrating the agendas of social, environmentally sustainable, and climate resilient health systems. Engaging with health professionals who are among the most trusted actors in society to help advance actions on climate. Mobilizing parliamentarians, city mayors, and other sub-national leaders as champions of multi- and intersectoral action to cut carbon emissions, increase resilience, and promote health. So this is going directly from mitigation of emissions and health, which is a nice way of thinking about how, mitigation is very strongly focused on carbon emissions and global warming targets. Does that necessarily guarantee that all the countries will have co-benefits on health, or will someone get increasing bad effects because of these global warming targets? That's not so clear. Applying gender-sensitive and rights-based approaches to protect vulnerable groups, determine action priorities, community and sectoral needs, and to ensure stakeholder buy-in. Building capacities to ensure the sustainability of adaptation interventions in the long run, and to promote continued innovation and problem solving for local populations. Pursuing integrated approaches to ensure that climate related policies are synergistic, multi and intersectoral, in particular in countries where resources such as human, financial, and technological are in short supply. So this is the report. To achieve health for all, we need to act now on climate change. You can go follow up on this here. Okay, so finally, the following gaps and barriers were identified towards transforming the health sector in the European Central Asian region to become climate resilient and low carbon. Lack of reliable, up-to-date climate and health data, risk information, and early warning systems. ECA countries require technical support to monitor and measure climate health risks and vulnerabilities, disseminate this information, and build capacity to address them. Policy, legal, and financial barriers constrain effective action due to inadequate mainstreaming of climate change aspects into health policies and vice versa, integrating health aspects in climate change policies and programming. So mainstreaming is a word we used before when we were talking about adaptation and its integration into fiscal policies, tracking macroeconomic issues related to funding adaptation, and on preparing people and firms to adapt and reduce risks and exposure and so on. Lack of cross-sectoral and interagency coordination is a barrier to taking an integrated water, energy, food, health nexus. Wrong emphasis. Lack of cross-sectoral and interagency coordination is a barrier to taking an integrated water, energy, food, health nexus approach to climate resilience. This is compounded by institutional and human capacity barriers within the health and other sectors. So we have to follow that up as well. Limited knowledge about access to and maintenance of climate resilient and low carbon technologies and infrastructure present further challenges to implementing resilient climate health strategies. So this reliance on technological promises is very extensive in future scenarios, and this can really be an important thing to watch out for when it comes to health. For example, if you are assuming that carbon capture and utilization or bioenergy with carbon capture is going to work at some scale and count on the health co-benefits from those, but if that technological promise doesn't materialize, then what happens to health with continued fossil fuel emissions and health impacts, right? Overall, there is insufficient awareness in civil society of climate-related risks, health risks associated with the prevalent unhealthy lifestyles, and the interlinkages between them, resulting in a lack of public and private sector engagement and momentum for action. There is a high risk that under the pressure of the immediate COVID-19 response, countries may not act decisively on climate change. Actually, this has already happened. The economic recovery, the stimulus funds for economic recovery from the COVID-19 effects have not necessarily followed up on climate action or green technologies and so on. They have gone more towards incentivizing consumption to kick start the economies. Even though there is some evidence that the renewable investments went up, especially because of the Russian invasion of Ukraine and so on. So all these things are kind of very closely interrelated in the sense that countries always put the climate action on the back burner. The clear example is now in October 2023, Rishi Sunak, the Prime Minister of UK, has basically said he's going to dial back on all the climate actions and funding for climate actions because he thinks country's economy needs to move forward and not worry so much about climate change. Okay, these are not something you can do about. These are part of the democratic process, outcomes that are not always desirable, but you have to deal with them. Health risks from climate change, again, just a schematic we have looked at before. Impact of climate change on human health from rising temperatures, so extreme heat, changes in vector ecology and increasing allergens, more extreme weather bringing severe weather and environmental degradation, and you have rising sea levels bringing water and food security impacts, water quality impacts, and increasing CO2 levels bringing air pollution, impacting things like asthma, cardiovascular diseases, chronic obstructive pulmonary diseases, and so on and so forth. Remembering again that more than 30% of the total deaths are related to cardiovascular diseases, and deaths directly from natural hazards typically are less than 1%. So when we jump up and down about climate action, we have to keep in mind that priorities can shift. If somebody decides health and reducing deaths from cardiovascular diseases is more important than climate change action, climate action, then you know it's going to be a struggle. So we have to always deal with these realities, socioeconomics, sociopolitics, and geopolitics, and so on. Okay?